When I first moved back to Virginia, I had to find an orthodontist to help me finish my Invisalign treatment. I found a great one, and we actually ended up becoming good friends. When I attended her baby shower, there were a lot of folks from the dental field there, and that's where I first learned about pediatric dentists. I don't know about you, but I grew up just going to my parents' dentist. I asked a lot of questions during that shower and walked away realizing that I wanted to take Addison, who was a toddler at the time, to see a pediatric dentist ASAP. And I'm so glad that I did. I'll touch on why during today's episode. Later, I found out that one of my good friends from college, Jo Cronly, ended up specializing in pediatric dentistry. She's been a great resource to me in recent years, and I'm thrilled that she's going to be joining me on today's podcast. Dr. Cronly is a pediatric dentist in Richmond, Virginia. And before we dive in, I just want to note that everything that Dr. Cronly shares today is intended to be educational and should not be considered medical advice. And since she and I are friends, I'm going to be calling her Jo throughout this interview. Hi, I'm Allison Egidi, a pediatric sleep and wellness coach and a mom of two. I love to help parents find solutions. This is How Long Till Bedtime. Hey, Jo, thanks so much for joining me on the podcast.
Thank you so much for having me, Allison. I'm super excited to be able to be here and talk about pediatric dentistry with you.
Yes. So as I had mentioned in the intro, Jo is a pediatric dentist. And for those who are clueless, like I was, let's start with the basics. What's the difference between a typical dentist, like the type of dentist I would go to, and a pediatric dentist?
Sure. We get this question quite a bit. Pediatric dentists are actually specially trained in age 0, to 18 or 21. After dental school, we go to a specialty residency for 2 or 3 years where it's just focused on pediatrics. So we're learning about growth and development, behavior management, phase 1 ortho, early intervention, all of the things, we just treat kids. So I think, one specific difference is with the pediatric dentist is our previous training, but also it's just such a narrow focus that we see kids all day long. When parents ask me if they're trying to pick which one, I say kind of equate it to your own PCP who could probably see your child, but if you were going to think about finding a doctor for them, you would probably seek a pediatrician over just your own adult primary care doctor.
Awesome. And I'm always interested in how people make their professional career decisions. So I would love to hear what made you decide to go into pediatric dentistry specifically.
So I actually knew that I wanted to work with kids before I knew whatever else there was. I feel I get such an energy being around children, and I'm happiest when I'm with kids. So at an early age, that was kind of stuck in my mind. And I feel like dentistry actually found me. I grew up in a very rural town on a dairy farm, and there just wasn't a lot of extra things in my life besides school. Now we schlep our kids to soccer and tennis and swim team and do all of these extracurricular things. And when I was growing up, that just wasn't made available to me. So one of my best experiences from a young age was going to my dentist, and then at the age of 11, going to my orthodontist. And I really enjoyed that. And this sounds so cliche, but it was really transforming for me. And so I think I just always loved dentistry and had that in the back of my mind. I feel like your smile is one of the most important things that you can have. And so once I settled on dentistry, I think I already knew that it was going to be peds or nothing.
I mean, the fact that you felt drawn to dentistry as a child, I think that means that was your calling. I don't know too many people who think they loved going to the dentist.
I feel so blessed because truly every day when I go to work, I'm just so excited to get there. And I feel so blessed that, I found that calling, because some people don't ever get to, find their passion, or they find it later in life. So it is definitely such a rewarding career. It's not for the faint-hearted. I mean, pediatric dentists, I think you just have to have a special mindset and a lot of patience and a lot of love for these kiddos. But we just get so much in return. So, yes, I absolutely love my career, and I could not imagine doing anything else.
I love it. Well, I posted in some of my private Facebook groups. So I have 2 different groups of moms, and I think you're familiar with them. And I asked them what questions they were interested in. And in the newborn group, there were a lot of questions because they all have newborns. And the question that was asked most often in that response was, when should we be taking our children to see the dentist for the first time?
Yeah, great question. So the American Academy of Pediatrics and the American Academy of Pediatric Dentistry recommends that all children be seen by age 1 or within 6 months of the eruption of their first tooth. And, that's really that first couple appointments is kind of a desensitizing appointment. It's for what we call anticipatory guidance, to kind of circumvent any early issues, answer questions, just look for those things that may be out of the ordinary, and just really establish that dental home for the child. So should there be trauma, or should there be issues or things that come up, you already have an established dental home and a dentist to call.
So would you say that's the biggest benefit of seeing a dentist early, is that you've already started to warm your child up to the concept of having someone poke around in their mouth?
Yeah, I would say that there are 2 major benefits of seeing a dentist early. Number 1, sure, is the desensitization. So we find, parents say to me all the time, I'm bringing my child in to see you this week. It's going to probably go pretty bad. And what everyone has to understand is that, yes, your 1-year-old or 18-month-old, 2.5-year-old, may have a hard time, and that's just so acceptable. But we find the kids that we start to see so early, by the time they're 3 and 4 and 5, they come in and they're so confident, and they know what to expect, and they're comfortable in that dental chair. And you see that autonomy and the happiness that they get with doing a great job. And the best part about that is, if there's a small issue, say there's a little cavity or something that needs to be done, the child is so used to that situation that then it's pretty easy to transition them into something that's maybe just a little bit harder, and to get that dental treatment done. I would also say the second major benefit of seeing a dentist early is that a majority of cavities are preventable, and so setting up really good habits and routines early really pays off in the end. And sometimes when we do see children later, there's things that have just been happening that we weren't able to circumvent, and sometimes you can't go back to that starting point.
Yeah, and I would say that I really think my kids benefited from me taking them early. And I think I've told you this before, but it felt like a little theater show when I took them the first time. So the hygienist were singing songs, and then the dentist was singing songs. And I think the kids were nervous, but they were so taken aback by the theater of the whole process that they loved it. And luckily, Addison hasn't had too many issues, but Ainsley has had trauma. So she chipped multiple teeth before, when they were baby teeth, and had to go in there for that. And luckily, we didn't have any major issues. But then she also has had some cavities because of some condition she has from being in utero. I can't remember what it was, but she has a little bit weaker baby teeth. And I was absolutely amazed. She went in there. It was a complete non-event. They worked on her cavities. And I'm convinced it's because she's been going there for years. She has no reason to think that anyone in that office is going to do her wrong. And so I think she's really benefited from going early.
I think that's completely it. And I do feel when kids come in later and they're nervous and scared, and I can tell that parents are upset by it or nervous or feel embarrassed. And I'm like, this is so normal. This is all brand new to them. So there is definitely something to be said about the desensitization. And there's nothing more rewarding than working with a child through an appointment and over subsequent appointments. I mean, when we have a tough visit, I look at the parent and I say, we didn't win them over today, but we will get there. And so there's always those that look at me and they don't believe me because they know their child better than me. But most of the time we do. It might take another year or 2 years, but when we do get there, it feels so good. And it's so rewarding for the child to feel good about something that they accomplished completely on their own, to get through a dental appointment and the cleaning and all of that.
So another question that came up a few times in that group was around when kids should be getting their first teeth. And I know that that's something I think they Google and find on the internet. But the bigger question was, at what point should a parent start to become concerned if their child isn't getting their early teeth?
The average age for a child to get their first tooth is 3 to 4 months. But that to me feels early. I mean, my own children were closer to 8 or 9. My husband was looking at me like, where are their teeth? And I'm like, I don't know. So it's such an average range because some kids do really get their teeth super early. And then, in that regard, it's kind of an uphill battle because, in that first year of life, they're taking bottles frequently. Or so you really do, when they get their teeth early, have an uphill battle to keep those teeth clean and free of cavities. So we have parents come in and they're worried. And I'm like, less teeth to brush right now. I think you could really maybe start to get concerned closer to 15 or 18 months. And I do have a few patients come in after the age of a year. And typically we get a little x-ray in mom's lap and they're there. They're just taking their time. And, there's chronological age, 6 months, a year, and then there's dental age. And so everyone's on a different spectrum. And we have some kids who, get their first tooth at 6 months and then others that are closer to that 18 months. And we just know to plan for that because that child who gets their teeth later most likely are going to lose their teeth later, get their permanent teeth later, all on the same kind of spectrum.
Is that genetic? Are they inheriting when their first teeth come in?
Yes, it is. There's a lot of stuff in dentistry that actually is genetic. We see, if a child is missing a tooth or has an extra tooth, a lot of times we'll hear that. And other times, just like with genetics, it can be just kind of an abnormality that forms spontaneously. But it does make sense. And we ask parents when they're like, I got my teeth really late, or a lot of times we'll see it in the siblings, well, he didn't get his first tooth until whatever. But then on the other token, it can also vary with families where we have some kids getting their teeth really early and then others that are just, more behind. And there's norms. So there's norms with race and ethnicity, and certain races or kids get their teeth earlier, and females typically get their teeth before males. But that's, again, all on like that average curve of where your child lies. And it can truly vary across the board.
Interesting. So around 12 months, if they haven't already seen the dentist and their child has no teeth, might be a time to pay a visit.
Exactly. And knock on wood, I have not seen it in the 10 years that I've been doing this, but, most of the time they're just delayed. Now, if there were other issues where truly, they were missing a lot of teeth or different things going on, maybe we would get them to a genetic counselor and just make sure everything was adding up. But most of the time they're just delayed. They're just taking their time.
Interesting. So on the teeth brushing front, when should people start brushing their kids' teeth? I'm assuming immediately once they have teeth, but do you think they should be starting even earlier with the gums?
I think the most important thing about teeth brushing is in establishing a routine. And kids, really crave that routine. And so at the very beginning, is it vital to, make sure you're in there and doing that full 2-minute brushing on those first two? Not necessarily. I think that the goal would be is once the first teeth start erupting, you could even take a clean, warm washcloth and just kind of rub on them. And the babies love it. They really, really love it. Just that stimulation on their gums. It's a little bit of time, probably closer to between 1 and 3 years old, where the resistance to teeth brushing really happens. But at the beginning, they just love it. It feels so good to them. So I think that just starting to get in their mouth, the desensitizing and knowing this is a routine, this is what we do. Nighttime brushing by far is the most important time to brush. We know that cavities typically form at night, and that is because all of us, when we're sleeping or even awake, but it's nighttime, our saliva is reduced. Saliva is the buffer that buffers out the sugars and the acids that cause cavities. So when we eat or drink all day and we don't remove that debris off our teeth, we're really, really leaving our enamel susceptible to get cavities. So I would say if you're going to pick one time a day to brush, nighttime's the most important. Establish that routine. And as a child starts getting into age 2 to 3, we definitely want you to start brushing in the morning as well. And this can be a really difficult time to do because you're maybe rushing out the door, you're doing this or that, and maybe you don't brush right when they wake up. I mean, I'm an advocate of brushing after breakfast. It kind of makes sense when they're young. And so I tell parents, listen, put an extra toothbrush and toothpaste in the junk drawer right there in the kitchen. They're still in their high chair. Come behind them right when they're done eating their breakfast and, brush really fast and be done. And then in the nighttime, really focus on that routine and doing a good job. But we want kids to start establishing this is a twice a day thing. So the earlier you do that, the better, for sure.
I have completely failed in that regard. So it is still a battle for me. I really was successful with the nighttime teeth brushing right out of the gate, but the morning is still a battle. And I definitely do not have my kids doing it 7 days a week. I am failing.
No, you're not. I'm a pediatric dentist. I tell parents this all the time. And there are definitely weekends, especially now, with everything going on, we're really not going a lot of places where I'm remembering before like rest time after lunch. So the goal is twice a day. If you don't remember by noon, that's okay. As long as you're doing a really good brushing at night, I think that is the most important for sure.
And then continuing with the teeth brushing topic, what about toothpaste? And then also the difference between the non-fluoride, kids toothpaste or fluoride-free kids toothpaste versus fluoride toothpaste.
So, fluoride is such a controversial topic. And I think the most important thing for all parents to know is that you are making the best decisions for your child, and no one else can make that for you. And so, on the topic of fluoride toothpaste, there was a great study done about a decade or so ago that showed, as long as you're following specific guidelines, that you can use toothpaste with fluoride in your child's teeth and avoid, fluorosis or too much fluoride. And just like anything, too much of something could be bad, and too little of something can be bad. So the American Academy of Pediatric Dentistry advocates that every child, regardless of age, and there are some kids who are born with natal teeth, they do recommend using a tiny rice grain amount of fluoride toothpaste. And, there's a lot of kids that come in and they're using the training toothpaste. And I say, that's great. You're brushing with something. And my recommendations go from there where, depending on your comfort level, maybe you could once or twice a week just introduce a tiny bit of toothpaste with fluoride for a couple reasons. Number one, that's going to strengthen the enamel and prevent cavities. And number two, it's going to, again, back to that desensitization. So we were finding that, the whole thing with fluoride is don't use it on your child until they can adequately spit. So that was kind of an old school thought. And they were starting to find that kids could not adequately spit until they were 6, 7, or 8 years old. And by the time that was happening, two things had evolved. Number one, the child was so used to using non-fluoride toothpaste that introducing that different tasting toothpaste was just, for a lot of kids, just really too much. And then number two, we were finding those kids, even with a not sugary diet, that there were breakthrough cavities. And so the recommendation is under the age of 3, a rice grain amount. And then 3 and up, you can start using a pea-size amount. So, definitely not that commercial Aquafresh swoop. You do not need to do that. I mean, I literally, for my just turned 2-year-old, I don't even squeeze the tube of toothpaste to express it. I just touch those bristles, and you can get, a really good, that's definitely adequate. And so if a parent's concerned about them ingesting, I say try it a couple times a week. And or at best maybe brush in the morning with the non-fluoride toothpaste, and in the evening, once again when we know cavities form at night, you could introduce the fluoride toothpaste, just a smear amount. If you want to go organic, there's so many toothpaste out there. There really are. And I tell each parent, you have to find what works for your child. Some kids, they're like those little old souls and they only like the mint toothpaste. That's how I was. I think that's why I was destined to be a dentist. I couldn't do the bubble gum or any of that. And then other kids, they want the bubble gum flavor, the grape flavor, that. So Colgate Crest are great. If you want to go organic, Tom's has a great strawberry one. But you have to look carefully on the bottle because they carry a strawberry one with fluoride and then without fluoride. So just make sure you know which one you want and purchase the appropriate one.
I'm also curious if you have your favorite hack for parents who have a preschooler who just fights getting their teeth brushed. Do you have a go-to approach, or is it just so dependent on the kid?
No, I do have a couple good approaches. And this is coming from, I have 3 children, 6, 4, and 2. And my oldest never gave us a hard time. She just didn't. And our middle child, our son, he would act like we were cutting his arm off every time we brushed his teeth. I mean, he really would. Like, he was screaming and crying, and my husband would look at me and say, "Is this okay?" And I'm like, "Are you going to help or not?" So it would be 2 of us. And so a couple things that we used on him that I think worked. And let me tell you guys all out there who are listening, trust me, it gets better. And it took a while for my son, but you have to think in their little worlds, there's not a lot that they can control. So they can control whether they eat or not. They're going to throw it off their tray because they know they're going to get attention from you, or maybe whether they're going to go to bed when they should. And another thing they can control is putting out resistance to you brushing their teeth, putting their clothes on, putting them in the car seat. And I think consistency is key. So you have, my son, we had to understand, regardless of how you behave in this moment, we're still going to do it. Just like when he would fight to get in his car seat, we didn't say, okay, you know what? He's not feeling today. We're just going to drive down the road, sitting in the car seat. It's not going to be strapped in because he just doesn't want to get strapped in today, because we obviously knew that wasn't going to be safe. So, I kind of equated to that. It might be a little extreme, but it's like, we're going to do it regardless of whether you give resistance or not. So when he was really young, we started making a game of it. If he had tacos for dinner, we would say, let's see those tacos, open big. Oh, I think I can see a taco in there. Where's those waffles? And he would start giggling and laughing and open big because he thought we were looking for all the food he had just eaten. And I don't know where we came up with that, but that actually really helped. And then as he probably got over that game and the resistance started again, and he was old enough to understand, we would just say, easy way or hard way. And he knew the easy way was him opening, us getting in there and getting quick and done. The hard way was going to be us holding it. And so he would always give some resistance, and we go easy, hard, and then we go, okay, hard. And then the second he goes easy, 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 and then he'd open. So I think, again, just knowing in that moment, unfortunately, the parents just have to show him who's boss. And are you always doing the best job brushing when they're crying and mad at you? No, but you're doing the best thing for your child in that moment. And that's what we would tell them as well. It's my job to take care of you. It's my job to keep you healthy, and we don't want you to get cavities. And so we're going to brush your teeth.
Yeah. Yeah. With my daughter, I ended up finding, well, both girls, but Addison would resist more than Ainsley. But I had this little hold where everyone won't be able to see, because of course this will just be audio, but where I would have the back of her head kind of on my chest bone, and I would be holding her forehead with my hand, and I'd be looking in the mirror, and I'd have her like propped on my knee. And if she was fighting, I would say, okay, we got to go. This is going to be the alligator teeth brushing job. I'd pretend she was an alligator and I was brushing
Oh, that's
teeth.
so cute.
And she'd be screaming bloody murder. And I'm like, oh, this alligator is really hard to hold. And I'd be brushing her teeth. And I always tell people, like, sometimes you just got to wrangle the alligator and brush their teeth.
Totally. And we have a lot of single parents, and it's hard for them because a lot of times we say, listen, if you have someone help you at home, that's going to be the best. Because we do, the little knee position, maybe put the child's head in the lap of the person who's brushing, and then the other person who's kind of holding them can look and hold their hands. And if you're by yourself, we say, listen, get on the floor and you can put, your child's head right there in between your legs, and you can kind of use, your legs to kind of cradle them and, just get in there and brush their teeth. And so, I'm sorry I spent so long on this topic, but I just feel like I have such a good experience from a child who truly just gave me all the things, and I'm like, your mom's a pediatric dentist. Like, come on, you can't be like this. And he was. And so, not every child is going to love it, and that's okay. But I would say the desensitization, like mixing up the toothpaste. One time we were traveling and my kids went into another orbit because we had forgotten their, specific toothpaste. And after that, I said, you know what? Sometimes I'm going to reach for that Colgate from Costco, and sometimes I'm going to get the kids bubble gum. And my 2-year-old, she is happy with whatever, because we've just used so many different, toothpaste on her. So
it's all making me wonder if you feel like being a mom yourself has made you a better pediatric dentist than the years when you were practicing before you were a mom.
Oh, totally. I mean, I always felt like I had a lot of compassion and empathy, and you have to for a pediatric dentist, to the point where sometimes it was hard for me to come home and leave it at the office. But once I became a mom, and when we start talking about pacifier and stuff like that later, a lot of things changed. And I don't think every pediatric dentist needs to be a parent to be a good pediatric dentist. But I do think in my personal experience, it has made me, cool. I just think more informative, and I can even put myself better in other people's shoes.
Totally. I think people are going to feel relieved to hear that you had a child who resisted having their teeth brushed. They will feel seen.
That's not the only thing he resisted, but I'll just leave it at that. So we love him so much.
So when parents are thinking about the most important things they can do to help their children avoid getting cavities, is it the teeth brushing? Is it not giving juice? Like, what is, when you see kids that have a ton of cavities, is there kind of the thing where you're like, oh gosh, I bet they X? Is something that you think parents should really keep in mind?
Well, and I think what everyone needs to understand is that cavities are a multifactorial process. So, everybody's mouth is different. And, there's something called horizontal and vertical transmission. And your child could be in daycare with another child who has a mouth full of cavities. And even if they're not sharing the same spoon or cup, studies have shown that when you're in the same environment, with other people, that you are going to grow the same bacteria in your mouth. And so, keeping your mouth healthy as a parent, a lot of times we'll see if parents, talking about genetics and all that, if parents have a history of having cavities or have active decay in their mouth, they could be sharing that really viral bacteria, that bacteria that's just very virulent and can cause cavities with their children. So, keeping yourself healthy and a healthy mouth, I would say it is a lot diet, that non-sugary diet. Listen, do my kids have desserts? Definitely. Do they get special treats? Do they get snacks? Yes, but it's truly everything in moderation. So if you're going to give that stuff, you also have to be ready to be really good at brushing, especially at night. And so a child can have a snack, but when they're snacking all day, so it takes, when you eat something, and it might not be a lollipop, but it could be goldfish, pretzels, fermentable carbohydrates that stick on the enamel so well. It takes 20 minutes for the saliva to buffer out all those acids and prevent a cavity. So if your child is over a period of time eating a goldfish here and there, watching cartoons, your teeth are never getting a chance for that buffering, because probably more frequently than every 20 minutes, there's another offense going. So have a snack, be done with it, move on. Don't snack all day. Everything in moderation. I do truly think that juice and sugary drinks, the schools, the school systems have it, the chocolate milk at school. And now that with the pandemic, the schools are providing breakfast too, which is amazing that they're doing that. But now most of my patients are getting chocolate or strawberry milk for breakfast and for lunch. So the American Academy of Pediatric Dentistry recommends no more than 4 ounces of a sugary drink a day. So that is not a lot. And sometimes I tell parents that, and I can tell they're looking at me because they're adding up in their head how many cups of juice or sugar drinks. And it does add up. Here's your orange juice for breakfast. Oh, take your lunch to school. I packed you a Capri Sun. We get home and maybe they're having a special treat. They had a good day at school and they're having a glass of lemonade. It truly does add up. So by maybe not providing it in the home all day, every day, they're going to get it at birthday parties and parties at school and special things, because you don't want to set up that daily habit where the child learns to expect to want that sugary stuff, right? And so that in and of itself is really going to help prevent cavities, good brushing, and just making healthy habits, and brushing well.
The other area where I'm also failing is having my kids floss every day. I mean, I'm just going to be honest and own this. They probably floss once a week. So, and it's just challenging to even do that. How important is flossing for the little people?
So I would say if you're brushing your girl's teeth once a week, you are probably in the top 10% flossing. You're in the top 10% of flossers. We could all, including myself, floss more. I talk about flossing all day long to my parents about and then I come home and I'm like, we have to floss. We need to floss. Go get the floss. So flossing to me is very hard. Just from a mom to a mom, I'm going to get really real here. It's hard to add that in. So I discuss that with a lot of parents, especially when patients have really tight contacts in the back and they're predisposed to cavities because they've got really tight contacts. But if you are brushing well and using toothpaste with fluoride, if you feel comfortable with using fluoride, and your child is mostly drinking plain milk and water, not flavored milk, not juice, I would hope that, and then you're flossing once a week. I personally think that would be enough. Would it be great if you flossed every day? Yes, but it would also be great if we, each did 60 minutes of high energy exercise a day and ate 10 servings of fruits and veggies. So, you really have to be realistic, right? We're busy. Bedtime is such a mess. I mean, you're fighting with your kids with everything. There's so much resistance. You're trying to keep on that schedule. So you have to do what you can manage. And I think once a week is a great goal.
Thanks, Joe. This is one of my arguments to my girls about why I don't let them drink juice at home. They do have juice, maybe if we go to Chick-fil-A or something, they'll have the apple juice, or maybe at a restaurant, they might get a Sprite from time to time. But my big argument of why they cannot have soda or juice at home is because we would have to floss more. So that's how I could talk them out of it.
No, and that's perfect. That's great. Yeah.
So on sticking with the liquids topic, I work with a lot of parents who have preschoolers. And as we're going through the bedtime routine, there are a lot of kids who are still drinking milk. They kind of went from having a bottle when they were under 12 months to transitioning to milk, and they just never got rid of it. So they're drinking milk right before they're going to bed, or I even have kids who have a bedtime snack right before they're going to bed. So the very last thing, I always work with them on removing that. So that's always part of our kind of sleep training process. But I would love to hear your thoughts from the professional. How bad is it for kids to be drinking milk or eating food right before they go to bed?
Well, this is the thing. Again, we talk about setting up good routines, and as we're cruising into that bedtime routine, really what we're trying to establish is, a calming environment where things are going to start to almost shut down to promote good sleep. And I liked what you have always said, and I say this to my patients all the time. No matter how your child slept the night before or how much nap they did during the day, at 7 p.m., they're going to get a second wind. And past that, it's going to be hard for them to go to sleep. So I would almost equate giving them a bedtime snack with you are giving them a second wind. So I think it's incredibly hard to give a child a snack, no matter what it is. I mean, it might be something healthy, it might not. But, giving them something that can then start that digestive system and almost kind of fuel their body and wake them up but then expect them to be able to put themselves to sleep. My kids do drink milk before bedtime. Our routine is my kids love milk, so we can't give it before a meal or even during a meal because they'll drink milk and not eat. And so right after dinner, if they've had a good day and if we decide we will give this special treat, the dessert, the what have you, right after dinner, we're still downstairs. So it is totally separate from the bedtime routine, and I would really recommend that. Just keep those things completely separate. As we're winding down again, we don't want to give them that second wind. And what we do is we provide the milk cups at the end, and as we're going upstairs and about to start doing the bath and stuff, they're drinking their milk. They may finish it right after the bath time, but then it's cut off. Because the other thing is my kids are not great water drinkers, and so unfortunately will try to drink a lot before they go to bed, but you're trying to promote them, right, to be able to sleep through the night and not, have accidents or what have you. I would say, really, that milk needs to be, close after dinner, and then you're getting into the bath and you're doing the books and all of that. And then that's a cutoff. And then for certain, you have to brush their teeth before they go to bed. And what happens a lot of times with this bedtime snack is maybe you're off the routine and then you brush. And I get this from a lot of patients who come in, they have cavities, and parents are like, we brush twice a day. And then as we're going through, because I'm such a problem solver, and so 99% of cavities are preventable. And I don't want to just treat a child and give the parents a bill. I don't want this to happen again. So I'm looking for how did this happen? And so a lot of times it'll be, they sometimes get milk or a snack before we go to bed, and then we don't brush again before they go to sleep. And then we talk about how cavities form at night and everything. So I just think, to be honest, they need to be completely separate, for their sleep habits, for, eating habits, and for their dental health. I would be a strong advocate for not doing that. And, past the age of 18 months, children are really able to, I think everyone gets worried. Maybe they didn't have a good dinner. Maybe they're going to be hungry, or they're going to wake up hungry, or this and that. And what I have found with my own kids, and this is not pediatric dentistry, this is just a mom, is that when you do provide that snack or something right after dinner in lieu, then my kids won't eat dinner because they know, there's going to be something else later to tide them over. So I'm trying to get them to eat those fruits and veggies and protein. And so if I'm always offering, and I've even found out with my 2-year-old, we've had to back off. She knows to ask for her milk right after a meal. She's not a great eater. And it's like, we need to give it some time, because she's just equating that. Yep, I don't want to eat this solids because you're about to give me a cup of milk. Kids are so smart.
They're so smart. Yes, my kids have gone to bed without dinner many a time, particularly Ainsley when she was a really picky eater, and it never affected her sleep. She had good sleep habits, but I worked with my pediatrician, has an interest in nutrition. I worked with a picky eater expert. Everyone assured me it's totally fine for kids to go to bed without dinner, and she survived, and she's a better eater for it.
Yeah.
And we did not get stuck in that rut of the milk and snack before bed. Mm-hmm. The early bedtime helps with that too. I think a lot of times the snack before bed happens when bedtime's happening so late, because kids sometimes have actually had time to get hungry again because their bedtime's too late. Right. So a lot of times the early bedtime helps.
I think that's a really good point. Yep. You're completely right.
And you've previously told me that you see a correlation between children's dental health and their sleep hygiene. Is that something that you could elaborate on a little bit?
That is, the audience who's going to listen to this, I've known Allison a long time, and she's helped me with all 3 of my children, specifically the youngest 2, and sleep train them. And I'm so fascinated with sleep. I always say in my next life, maybe I would be a sleep consultant, even though I love pediatric dentistry so much. But I've learned so much through you, Allison, and I've really managed to put that into my practice, because pediatric dentists have such a unique ability to see children, a lot of times more than the pediatrician. If you have a healthy, well child, your pediatrician sees you once a year. So we're typically seeing kids twice a year, and I see these kids come in, and if they're looking overly tired or not at their best or not well, and I find a very strong correlation to patients who have poor hygiene habits, have cavities, poor eating habits, and typically they always have poor sleeping habits. And so, it's been great for me. And sometimes it's unsolicited advice, but really these kids, these little babies who come in, past the age of 1 or 2, and the parents are so tired and they're up all night, and you can tell. And a lot of times, there's a couple habits going on, where maybe they're co-sleeping, and then they're also, every time they wake up, they're getting a bottle. And I love your analogy about the pizza at 2 a.m. If someone shows up at your door with a pizza, you love pizza, you're not going to refuse it, right? But do you need that pizza at 2 a.m.? So talking parents through, the times where the child needs to be sleeping or eating. And it's really, I will tell you that an unhealthy child is going to play out for sure. And we're going to see the dental cavities. We're going to see, poor sleep habits. And so it certainly helped me in my practice. And I think that dentistry as a whole, and pediatric dentistry for decades have been moving more towards, it used to be probably in the 70s and 80s, you walked in and you just looked at the mouth. And now it's the whole head and neck. And really each child, we're treating that whole child and what they need. And I think parents appreciate that, taking the time to talk about diet and eating habits and sleep habits and brushing habits and all of the things, so that they can set their child up, to be healthy now and then when they're older.
Oh my gosh, it makes my day to hear that you have incorporated some sleep conversations into your work. I love that. All right, let's talk about the good old pacifier. Both of my kids loved their pacifier, and their pediatric dentist here in Charlottesville had told me that in order to prevent permanent structural issues, for lack of whatever medical term you would use, that it was really important that I limit their pacifier to the crib at the age of 2. And that by 3, we had completely gotten rid of the pacifier. And so that's what I did for both of the girls. And Ainsley had significant deformity. I don't know, maybe that's not what you would call it, but she had a huge overbite. She basically had no chin, and he was convinced it was all from the pacifier, but he stayed with the, dump the pacifier by 3. She'll be fine. He said in 6 months, this is going to correct itself. And by golly, it did. She ended up with not even having an overbite, and we threw him away on her 3rd birthday. And I have people ask me about this all the time with the pacifier. So what is your recommendation on the pacifier?
Yes, so it is definitely a controversial topic. I think, listen, every child under the age of 1 has a non-nutritive sucking habit. So that is what they are born to do. So they are going to suck on something. It might be a bottle, a pacifier, their thumb, their fingers, a lovey. So under the age of 1, non-nutritive sucking habit. After the age of 1, it's purely a habit. So you could argue on one side that obviously the least amount of time past the age of 1 that they do it, the easier it would be to kick the habit. But I really don't get that worked up about the pacifier anymore for a number of reasons. And we'll probably, talk about thumb sucking later. But I always tell parents they're not going to take their pacifier to kindergarten. They're going to take their thumb to kindergarten. They're not going to take their pacifier. So, there's these great studies that are being done to show that actually some kids who prefer a thumb or a pacifier, or my 4-year-old son who actually sucks his lower lip, it's kind of that analogy, what came first, the chicken or the egg, that maybe their jaws are positioned in such a way where their comfort at resting has to have something in there to create a positive seal. And so we see a lot of kids with thumb sucking and pacifier habits who you discussed, they're doing their own orthodontics. So, we want the top jaw to fit over the bottom like a lid on a cup. And when children have a sucking habit, what they're doing is they're constricting that palate and forcing the front teeth out. So it's all about frequency and duration. I see some kids who suck a pacifier all day long, and the parents tell me they do, and I barely believe it because their teeth are in pretty normal position. I see some kids who have a pacifier 1 hour a day, and their teeth, bless their hearts, are sticking out like Bugs Bunny. So it's all about how hard are they sucking and that duration frequency. So at a young age, I would say I promote that. I do love the keeping the pacifier in the crib, just because, again, expectations, routine, if it's made available to them all the time, they're going to suck it all the time. And so I would say the goal is when they need to self-soothe themselves, naps, bedtime, long car rides, not feeling well, that is when they should have it. And the other times we want to promote that babbling and that talking to develop, so a lot of kids who end up having a pacifier in for years and years and years end up maybe being late to talk and stuff because it's more comfortable to them to have that instead of forming those babbling words and doing those things if the pacifier were not in. So I definitely agree with your pediatric dentist. I think that's great. To limit in the crib by 2. And this is what I tell parents. Every child is unique. You are going to find the time that works for you. Don't do it when you're potty training. Don't do it when you're transitioning to the big girl bed. And I'm like you, a very strong advocate for keeping a child in the crib for a while. And I tell parents, if you're thinking about kicking the pacifier, I would not get them out of the crib yet. Their crib is their safe place and it's their comfort. And so think about it. If you transition them to the big girl bed, big boy bed, and then you decide to take the pacifier, what are they doing? They're getting out of their bed and coming to their room looking for the pacifier. But when they're in their crib and their safe home and place, it's almost like their own little cocoon. And so I tell parents, I go, listen, after the getting on to 2.5 or 3, a couple things are happening. It's turning more into a conversation that you have instead of just like, oh, where did that thing go that you loved so much and needed to have every time you went to sleep? But oh my gosh, you're actually putting yourself to sleep great now. And we have parents come in and the kids are in daycare and don't have the pacifier at all, even for naps. And I'm like, you're halfway there. They're taking great naps. On the subject of naps, if you've let the pacifier habit go to past 2, you're thinking of taking the pacifier away, you need to do it fast because you are in danger of jeopardizing that afternoon nap. And so I tell parents, listen, if they still really need that nap, which I think they do, and you take the pacifier away and after a couple days, they're not going back to give it back because I think naps are way more important, right?
Yes.
And so that's another thing where some parents come in and they can't stand it, they want it gone. And I'm like, okay, I would do it closer to 18 months to 2 years old because they're not going to kick their nap. But when you get in between that 2 to 3 window, you're getting dangerously close to them. And I do get parents all the time that say, yeah, we've took the pacifier away at 2.5 and they stopped napping. And, that's really unfortunate. At that point, I would maybe provide it for the naps and get yourself through. Cause to me, that's more important. And, I had a niece and my sister, every time she went to do it, there was an ear infection or she had another baby or there was all these things. And bless her heart, Claire was 5 years old. And, it was a conversation like, you're 5 now. And so not every child is going to fit into that perfect recommendation, and you have to do what is right for your child. But just understand that there's going to be things along the way to make it easier or harder for you should you choose, at whatever age to kick the habit. Does that make sense? I know that was kind of long-winded.
It does. I'll have to do a whole episode on my breaking up with the pacifier process, but I do agree with you. It can definitely throw off naps. That was the reason I held on till 3 for sleep, was to keep the nap. And Addison still napped till she went to kindergarten, but Ainsley, it was the beginning of the end for her nap. She went on a hiatus, it came back, but never the same after we got rid of the pacifier. And then Addison, we did get rid of it at 3, and she immediately started sucking her thumb.
And I'm so glad you mentioned that.
Yeah, talk to me about the thumb and how often that happens.
Yeah. So I never thought I would say this till I was a parent, but I say it now, and this is a mother to mother. So you can go to other pediatric dentists and they would totally disagree with me. But if I had a child that had a pacifier and I took it away and they started sucking their thumb, I would probably give the pacifier back.
Yeah, is the thumb, does it cause more damage or just you feel that it's harder to break up with?
So, yeah, great question. Again, it's that frequency and duration. I find the thumb habit tends to be around longer because it's fixed to the person. And so it's just not an out of sight, out of mind situation. And, you know, that's that. And again, I never thought I would say this. And this is why my husband sucked his thumb until he was 9 years old. The OB would always say, "Oh, look," to my oldest daughter, "look, she's sucking her thumb." And I'm like, I'm not amused. I'm a pediatric dentist, like in utero on all the ultrasounds, sucking her thumb. And so when from a young age, around age 4, I felt like she started popping it in. I think my nanny thought I was going to fire her if she started sucking her thumb, which I would never do. But I was like, let's keep her hands busy. We would give her things. And the other thing is, once she was done with the tight swaddle, I'm a strong advocate of the zippity zip because they have all the movement, but their hands are covered. I think it's also great for warmer climates if there's mosquitoes to protect their skin. So, you know, my youngest, she still sleeps in her zippity zip. I think she thumbs on that. She sucks on the fabric on the thumbs, but she doesn't get to it. So, you know, listen, if they're going to be a thumb sucker, they're going to be a thumb sucker. You can try these things and do these things, but some kids are just born to suck their thumb. So, you know, I don't want you to be discouraged if that is the case. But yes, I do think the thumb is definitely harder because you just can't take it away. There's all of these things that you can do. And did Addison stop sucking her thumb, or
The
does she
dentist
still?
helped. He was super helpful. So he talked to her. I saw him shortly thereafter, and he said, "All right, you've got to stop," because she was 3, and he said, "We got to work on it. When you come back in 6 months, I'm going to give you 2 prizes, you know, if you stop sucking your
Yep.
thumb." And he talked to her about it. Could you really try? And he said, "Look, if you come back and you haven't stopped, I'm going to have to install something in your mouth that's going to make it so you can't suck your thumb. So we got to work at it." And she agreed to work on it, but she just couldn't kick it. So then she came back and he said, "Okay, we have one more trick. We can paint your nail so that you'll remember when you forget and you stick it in, you'll taste it. It'll taste bad and you'll remember to take it out. And then otherwise I really have to put that thing in." And the nail paint worked. So we had to do it religiously for maybe 3 weeks. And then she was very excited to go back and tell him too. I mean, she said, "I got to go tell the dentist that I stopped." And so he really gave her a pep talk, and we did kick it, but it was harder to kick than the pacifier. Granted, when we kicked the pacifier, she just grabbed her thumb. But I find with a lot of people, they say even if they tried to stop the thumb, they couldn't stop it. That their child just, I mean, as a baby, they couldn't stop their infant from sucking their thumb.
Yes. Sure. And parents come in super concerned when they're
Yes,
infant.
yeah, and there's not a whole lot you can do about it, right?
There's not. I just say at this young age, under the age of 3, 4, keep their hands busy. When they're not sleeping, napping, self-soothing themselves with the thumb, you want them playing, keep their hands busy and interactive, and that's the best you can do. Studies have shown if you stop sucking your thumb before the permanent incisors come in, or in the front around 6 or 7, there's not going to be any deleterious effects to it. But again, it's all about frequency and duration. And there are some kids who just suck their thumb so much and do so much orthodontic work that even when the front teeth come in, if they've stopped, you know, there's that crossbite or protrusion, and what have you. And there's all kinds of things, Allison. So the nail polish does work for some it does not. Some moms used to put on hot sauce. We're not an advocate of that because then the kids start to love the hot sauce and they want hot sauce on all their food. Okay. True story. There's these elbow extenders you can get. So it can you can bend your elbow, but not all the way to put the thumb in. And then there's also thumb guards, all, you know, stuff on Amazon, of course, that you can get to. It's like a reminder.
And you know what that's reminding me of is a friend of mine who's a plastic surgeon, and during her residency, this is when my girls were little, and she said, "Oh my gosh, if your kids ever suck their thumb, whatever you do, do not tape their thumb, because today I had to amputate a child's thumb because the parents had put medical tape on it to try to stop the thumb sucking, and they put the tape on too tight, and she had to amputate the thumb." So I assume you would like to tell everyone, do not tape your child's thumb.
Yes, in residency, I had a child, a little girl, never forget her, who came in and she did not have a thumb. And when we were reviewing the medical history, the mom said somebody taped her thumb too tight. to get her to stop sucking it. And I mean, I think it, well, so definitely please do not tape your child's thumb. And I actually did have, I'm in a great pediatric dental group, and I did have a pediatric dentist who used the thumb guard and on her young child. And I think that the child, while she was sleeping, was pulling at it, and she really tightened it, and it didn't cut off circulation, but it can leave creases. So as with everything, proceed with caution. And maybe with the thumb guards, make sure they're a little bit older, where they either use it as a reminder or they can just remove the whole thing.
Right. All right. Now I want to dive into some of the more controversial topics. One being about the treatment of lip and tongue tie. So I feel like this is becoming more and more common. And I'm curious, is it that we know better, know better, do better, and now we know how to diagnose it and fix it? Or why do you think this is becoming something that more and more people are having fixed? In fact, you and I have a common friend that's about to get her daughter or her son's tongue tie fixed. And so I'm just, what's up with that? Everyone's talking about it.
It is such a hot topic. And I do think that it, in the last 5 years, we were not talking about this 10 years ago. We really, really weren't. And so, as with everything, knowledge is power. And I think there has been a lot of recent studies, and people are really starting to look into, not just the teeth, but the whole oral cavity and the structures and everything that accompanies with it. Like I mentioned, maybe kids are actually sucking their thumb because it's otherwise they're not creating a positive, resting position. Now we're looking into how kids are breathing, and do they have a patent airway, and if they have a narrow palate, and is that because the tongue is positioned, posterior and such. And so in our practice, we do have CO2 lasers, and we do releases. We do releases on infants, and we get referrals all the time. And I will tell you, we do get referrals that we evaluate the patient and we say, all is good. I mean, there are some kids who come in. I saw a girl, I think it was about a year ago, and I've never seen such a restriction on her tongue. Like, the poor girl could not move her tongue anywhere. Like, she couldn't even lick an ice cream cone. And her speech was a little bit off, but she had compensated. And, I said to the parents, I said, listen, this is one of the worst restrictions I've ever seen. We can leave it. I mean, she's talking okay, she's functioning, and we just review the options. And I think that, if I'm being brutally honest, I think that a lot of times specialties feel like, everyone's always looking for a solution, and that sometimes doing a release may feel like a quick fix. Oh, this child is not nursing well, it has to be, there's a tongue tie. Or, oh, this child is struggling to form certain sounds, there's a speech delay, there has to be a tongue tie. And sometimes there is, and sometimes we release them and we get great results, but other times not so much, because everything is so individual to the child. And we see some children who are very restricted, but they've never had a problem nursing, and they have great speech, and they've compensated. And so I think that analogy where if you have a hammer, everything looks like a nail, we just, in our practice, we are super, super prudent. Our motto is never do a procedure on a child unless you absolutely have to. So I would encourage moms and parents out there who maybe their lactation consultant mentioned it, or maybe their speech, to just go through the proper avenues. And there's something called a tethered oral tissue provider, or get a TOTS provider on board and really have that patient evaluated. Because the other thing is just doing a release on a patient, may not help them. After that, there's work with that, right? Like, if a mom comes in, I think there's a restriction, he's having a hard time making sounds. Well, do you have a speech therapist on board? Because if I do this release, is there someone afterwards to help your child improve what we're trying to improve? What are our goals here? And so we see a lot of infants that are failure to thrive and are having problems latching, whether it be nursing or the bottles. And we really do defer to all the specialties, the pediatricians, the lactation consultants, the tethered oral tissue providers. And we're just very cautious, like I said, for each child. You just have to be careful, because I tell parents realistic expectations. We could release this, and this you could see improvement, or we could not. And setting them up to understand that this could help or this could not. And it is controversial. And there's some ENTs, I find who are aboard, and there's others who are like, this is a fad. And so, we're not going to go this direction. So I think being an advocate for your child and just being well informed, and finding someone who has experience with it and not someone who's just going to do the release because you ask them to is really most important.
What's a tethered, or what did you say that was?
Tethered oral tissue provider. It's someone who has done specialized training, and sometimes it might be someone who is an occupational therapist, or they were a feeding specialist or a speech therapist who's done extra training in this area. And I would say they're going to know the most about, the attachments and the classifications. And like I said, as a practice, we have the CO2 laser, which is great. There's no heme. It's quick healing. It's almost like, not to get graphic, but comparison to doing a circumcision on a newborn baby. So, we find that when it's necessary, it's a quick procedure and we're able to provide that. But again, we just don't do it unless it's absolutely necessary.
All right. One more big controversial topic is one that I've been interested in because, like I've already mentioned, Ainsley ended up having a couple cavities. We had a really good experience. She was comfortable with the dentist, so I'll preface it with that. She was not terrified to go there, but they gave her a little bit of laughing. I don't think they called it laughing gas, but that's what I would call it. A little bit of gas to chill her out, but she was still totally talking, responsive. I was in the room the whole time. She was answering questions. She was following directions, and they took care of it, no issue. And I have several mom friends I know who have gone to a certain practice nearby where if there's any cavity work that needs to be done, they are putting the kids fully under. And I was a little taken aback because they weren't really taking it by case basis. And I guess I'm curious if you think people should question that or ask more questions if they're seeing a dentist who just says, okay, we got to have some work done. We're just going to put them all the way under. That's what you need to do with kids.
Number one, the most important thing you can be for your child ever is an advocate for them. So if you're in a practice and something does not sound right or feel right, please seek a second opinion. I think that it is important. There's 9 times out of 10, a child can come in and have their cavities fixed just like your daughter with maybe a little bit of, laughing gas. We call it astronaut air. And we have Disney Plus on the screen, on, the ceiling, so they get to watch a movie. And the goal is for any child to give them that autonomy to do this because they may have cavities as an adult. Like that is what we're working towards, right? Is that safe and effective treatment. And so 9 times out of 10, most kids can do that. And our practice does offer all ranges of treatment. So we do offer the laughing gas. We do an in-office light sedation, like you or I having an adult beverage to just kind of take the edge off. And then we do the full sedation as well. And we always try with the first option. The only time we wouldn't try with the first option if it was, per se, a 2 or 3-year-old who couldn't sit in the dental chair at their exam. But if a child comes in for us and they can sit, lay back in that chair and do an exam and get x-rays, that tells us that we can really work with them and that they're going to probably handle treatment great. Are there going to be moments that may be a little bit tougher? Maybe, you might want mom to hold your hand through the numbing part or what have you. Sure. But again, allowing a child to just be independent and do these kind of things on their own and feeling good about themselves at the end, you definitely can't put a price on that. And are there patients who it's interesting. I had a patient last week. He was such a good kid. He was pretty young and ended up having, multiple cavities. And we worked with him for an hour and he was so good, Allison, and went through the numbing. He got numb. He was watching that movie. But every time we went to work in his mouth, he started gagging, and then he actually kind of threw up a little bit, and he just couldn't tolerate anything really being in his mouth. And that's really tough because he wanted to do it, right? And so sometimes there are physical obstructions or patients with a small airway, big tonsils, where when we're working in their mouth, they feel like they can't breathe. Maybe they're mouth breathers. Some kids who have, really tough sensory issues that are great, but once you start that drill and they can hear that handpiece, it puts them into another orbit. So I don't think that every child fits into this, perfect model. And I think for our practice and a majority of pediatric practices out there, dental practices out there, we are going to provide the care needed specific for your child. And if it doesn't feel like that's happening, then I would recommend, seek a second opinion. And, sometimes it's just a conversation. To be honest, I had a second opinion this morning from a great pediatric dentist across town. And their child was very fearful and needed a lot of work. And we talked through it. And I spent a lot of time reviewing everything and risk and benefits. And in the end, I think they felt confident with that dentist treatment plan because they were like, you explained it and we gave the parents the options, and they drove far to see me. So I think they were going back. I recommended, she's great. Go back to her. She's closer to your home. But sometimes it's just that parents need to feel like they're understanding everything that's happening. And it is tough, we're pediatric dentists can get busy and seeing all the patients and trying to fill that need. But I think that just trying to put each child into a specific category that the pediatric dentist wants to do is really not acceptable. I mean, our profession is in and of itself behavior management. That's what we do. So immediately just putting children to sleep to do the treatment isn't really pediatric dentistry, to be honest.
Right.
I mean, anyone could do that.
I have one last question before we wrap up. What do you recommend to people who live somewhere where they don't have a pediatric dentist? So I'm assuming, I don't think we had a pediatric dentist where I grew up. I could be wrong, but what do you suggest for those folks? Or does everyone generally have a pediatric dentist within driving distance?
Yeah. So, Allison, they don't. I mentioned I grew up in a rural area about an hour outside of Charlottesville, and we grew up driving to Charlottesville. And in fact, that dentist retired just a couple of years ago, but my mom drove us an hour to see a pediatric dentist. And I think that was just important to her. She could have not done that. And we have patients who drive from all over Virginia. Also, a lot of times too, because we take a lot of insurances and a lot of practices don't. And so they're finding a provider where their insurance is covered in. There's a lot of great general dentists out there, and they, a majority of them do a great job treating children. And the good ones are going to know when a child needs to get to a pediatric dentist. And so if you've got a great general dentist in your town that you trust, and you know that if it gets to a point where maybe there's a situation that they don't feel as comfortable handling, and then they send you somewhere to drive, I think that's great. I mean, some parents choose to take the drive and others don't. I mean, we see some kids just to treat their cavities, and then every 6 months they go to their general dentist, and then they call us, and that general dentist calls us if there's an issue. And we're fine with that. I mean, these kids, we don't want them to miss a lot of time with school, and it's taxing on the parents to get them, far distances. So as long as they're seeing a dentist every 6 months, that's okay.
Awesome. Well, we have covered a lot today. I really appreciate your time. And I would love if you would share with everyone where they can find you, particularly if they're in the Richmond area.
Yes. So I am one of the owners of a pediatric dental practice called Children's Dentistry of Virginia. And that's www.childrensdentistryofva.com. We have 3 locations. So we have one location, if anyone's familiar with the area, kind of towards Short Pump, one location in Midlothian, and then another in Chester. So you can look us up, on the internet. And even if you want to ask me a follow-up question about anything that, Allison and I have discussed, just send her an email and she can give you my information, and we can get in touch that way as well. So thank you guys so much for listening and hanging in there. So it's been a lot of information.
Yes. And I will link to your website in the show notes as well. Well, thank you so much, Jo.
No problem. I really, really enjoyed it. I hope you have a great night. Thank you, Allison.
Thank you for listening to How Long Till Bedtime. To learn how we can work together to improve your child's sleep, please visit sleepandwellnesscoach.com.